All right, today we are going to talk about anemia. So just be warned, anemia is a huge chapter. There's lots of information here. Do your best to try to get through the material efficiently and try to find some patterns that you can use to help you work through the material and make some connections pretty quickly, because what tends to happen is students spend a lot of time on anemia for exam 2 and neglect the other chapters because they run out of time. So just be aware, lots of stuff. It's going to take some time to get through all of it, but we will do our best to give you some framework here. So this is our comic relief about anemia. Talking about iron shortage. It's just funny. So if you haven't looked up the Awkward Yeti, they have some healthcare stuff that's kind of funny. So anyways, moving on. Okay, so anemia, by definition, is a deficiency either in the number of erythrocytes, which is just the fancy word for red blood cells, the quantity or quality of hemoglobin, or the volume of packed red blood cells. So the picture there on the right-hand side is the picture of a red blood cell. Looks kind of like a lifesaver, sort of, or a red donut. And then the picture in the middle, you see the arrow pointing to that cell that's a little bit larger than the others. That's what megaloblastic anemia looks like. So you got these cells that are larger than they should be, and they're immature, so they don't function right. And then the picture on the left-hand side is a picture of like an artist's rendition of what hemoglobin looks like. So it's this molecule that has these 4 sections that are all kind of wound together, and that's what carries your oxygen. So either then you don't have enough red blood cells, either the quality or quantity of your hemoglobin is messed up, or the volume of your packed RBCs is not sufficient. So moving forward. Okay, so what is the job of a red blood cell? Basically, it's a glorified like truck, right? So it carries the oxygen around the body. And then they carry away the CO2. So that's the job of the red blood cell in your body. And if you don't have enough, they're not made correctly, or they're getting destroyed, then you wind up with anemia. Just a quick definition, hypoxia and hypoxemia. So they sound very close. You add an E and an X and you jump back and forth between the two. Oh, I guess an M too, whatever. Hypoxia is when your PaO2 falls low enough to cause signs and symptoms of inadequate oxygenation. Whenever you have signs and symptoms of anemia, it's usually associated with hypoxia, okay? And then hypoxemia is the O2 transfer. So the O2 in the arterial blood is less than the normal value. So hypoxemia is talking about arterial blood O2, okay? Hypoxia is talking about your levels are low enough to cause signs and symptoms. So, yeah. Okay, so going through what the causes of anemia are. The first one is just decreased red blood cell production. So that happens a couple ways. You're not getting the nutrients you need, like we talked about in our little cartoon about iron deficiency. Coalbumin and folic acid are both B vitamins. If you don't have enough of those, then that can cause trouble. And then if you have kidney disease, that middle one, you don't have enough erythropoietin, and so you're not generating enough cells. And then if you don't have enough iron, iron comes from the liver. So if you have liver trouble, then that could be a thing. Then you have just blood loss. So you're actively losing blood. You can lose blood a couple different ways. Chronic ways are things like bleeding ulcers. If you have colorectal cancer, they can bleed a lot. Liver disease, they have lots of bleeding trouble associated with liver disease because your liver's in charge of your coagulation stuff. So we'll learn about that here in a couple weeks. Or if you just have like an acute blood loss, so a trauma, you rupture your aortic aneurysm, that's a big one. You can bleed pretty fast from that. GI bleeding can also be acute, especially if you're talking more upper GI, those bleeds can be pretty fast. Again, with liver patients, they can have some acute bleeding where they get anemic in a hurry. You can also have increased red blood cell destruction, so where the cells themselves get destroyed. So that's what's happening in sickle cell disease. I'm sure you've heard of it. Their cells are just not made correctly, and then they get chewed up quicker. They have shorter lifespans. Some medications, although that's pretty rare, if you give somebody incompatible blood, that's one of the reactions you can have is the cells of the blood that's not compatible get lysed, or trauma. So if you have like a heart valve that's chewing up your cells, or if you go on bypass for like a surgery or something like that, that could be a thing. Okay, let's go to diagnostics. So of course, as you would expect, CBC is the main thing that we look at, particularly the hemoglobin and hematocrit. Hemoglobin is actually the one that I'm most familiar with referring to when talking about anemia. It determines how bad your anemia is, okay? Once you say that a patient is anemic by looking at the hemoglobin hematocrit, or the H&H is what we call it, then you do more investigation to try to figure out what the cause is. So you're going to look at your total red blood cells. Is that the problem? Red cell indices, are they too big? Are they too small? Those sorts of things. So it breaks out into some pretty detailed information that will give you what you need to know as far as identifying types of anemia. So don't get too much in the weeds. It's not expected that you know all of those specific things about the rest of the CBC, but you are expected to know the hemoglobin and hematocrit for sure. And ESR, if you have like an inflammatory problem that's going like that, something like that. Folic acid and B12 are both, if they're deficiencies, then you can cause anemia that way. So anemia can result from a primary hematologic problem or as a secondary consequence of some disease or disorder, like we talked about kidney disease or liver disease. Then you can get anemia that comes as a byproduct of that. Peptic ulcer disease, or like a primary problem with like production itself of red blood cells. Okay, so diagnostics. So CTs. So the picture on the right-hand side is a picture of a CT scan of the brain, and then the image above it is the picture of a CT scanner. Looks like a giant donut. Pretty quick test, takes minutes. You can do with or without contrast. Gives more detail than an X-ray, but if you look there on the left-hand side, the image of the brain compared to the CT scan there for the MRI, you get a lot more detailed information. It takes a lot longer to get the images, but you can see all the structures. So, yeah. So this is a picture of some general clinical manifestations. You won't necessarily get all of these symptoms with every type of anemia. For example, the yellowing in the eyes, that happens only when you have damage of your red blood cells. So if you have like just like a iron deficiency anemia, you're not going to get the increased bilirubin levels that it would cause the yellowing of the eyes, okay? But general anemia, you're going to see some paleness, you're going to see some shortness of breath, some weakness, fatigue. You can get low blood pressure, especially with volume deficient anemia, palpitations, those sorts of things. So some signs and symptoms are specific to the cause, and some are pretty general, okay? So pallor, where would you see pallor? So think about where you would see pallor, especially on somebody who's got darker skin. People who have light skin, it's pretty easy to see that they're pretty pale, right? But if you've got dark skin, you have to look for pallor in other places. And I would also go kind of area of the body, you know, start with the skin, then talk about your heart. What pulmonary complications would you have? What neurologic complications? What GI complications? And then just general. So general signs and symptoms would be things like sensitivity to cold, weight loss, lethargy. Okay, so your assessment. So you need some subjective data. So health history is important. What kind of past medical history do they have? What meds are they on? Any surgeries? What kind of diet do they have? Are they on some kind of restrictive diet? So, for example, vegans have a lot of problems with B vitamins just because they're not getting typical sources of protein, was where you find those B vitamins. So, um, and then functional health patterns. Are they taking their meds? Are they eating? How are they going to the bathroom? Do they have dark tarry stool? Is their activity what it was 2 weeks ago or 2 months ago? And then how are their thought processes? Are they feeling fuzzy headed or something like that? Case study question number 1. KL is a 24-year-old female with increasing lethargy, inability to pay attention at work, and headache, which is not typical for 24-year-olds, right? She has a pale, beefy tongue and inflamed lip. So the beefy tongue with inflamed lip is specific to a type of anemia, okay? She tells you she's breastfeeding her 4-month-old. What should you do? All right, so with this lady, we need to get a little bit more information, right? What kind of health history? Let's find out about the delivery. Was it complicated? What's her nutrition been looking like? Is she on any meds or supplements? So you need some more information for her, okay? So let's talk about iron deficiency anemia. So iron affects how hemoglobin is synthesized. And remember, hemoglobin is what carries the oxygen, okay? So it's really important that that hemoglobin gets made correctly. It's the most common nutritional disorder. People that are at risk are the young, the very young, the poor, um, and then people that just have poor diets, and then women in reproductive years, okay? Causes could be just inadequate intake, malabsorption, blood loss, or hemolysis, so destruction of cells. Blood loss can come from things like peptic ulcers, gastritis, diverticuli, hemorrhoids, or menstrual bleeding. You're going to see things like pallor, glossitis. Glossitis is that inflammation of your tongue. And then cheilitis, I think is how you say it, is the inflammation of the lips. Okay. Um, Treatments, it's dietary. Okay. So if we get enough dietary supplementation, you're good to go. A lot of like prenatal vitamins and stuff will have added iron because folks uh, who are pregnant are at risk for iron deficiency. Um, so things like liver and muscle meats, dried fruit, legumes, dark leafy greens. That's why you got your spinach there. Whole grain bread, cereal, beans, all are treatment for iron deficiency. So you're going to do some lab work, right? We want to check the stool for blood. We might do an endoscopy or a colonoscopy to see if they've got any GI bleeding that's happening somewhere that might be contributing to any of this. So our friend KL has some lab work done, and her results are back. It shows that she has a decreased hematocrit, hemoglobin, MCV, iron, ferritin, and transferrin, and increased TIBC. So don't worry too much about all the details of transferrin and MCV and what the normals are of those sorts of things, but do know the hemoglobin and hematocrit, right? So likely cause, there's a picture in your textbook that kind of names out what the labs look like with these different anemias. Don't spend too much time on that, but this is a picture of what iron deficiency anemia looks like, okay? And remember, for our treatment, we're going to do dietary supplementation. So she can either eat or just take some supplements that have iron in them. So she tells you she can't afford medicine. She has 3 children, her husband's out of work, her income is barely keeping the household going. Anything that costs money is out of question. So what can you teach KL about the effects of anemia if you don't get it treated? So in severe cases, anemia can lead to things like myocardial infarction. So it's a lack of oxygenation. It's a different cause than like acute coronary syndrome, right? But it's the same result, is a lack of oxygenation to the heart. And with that, you can get heart failure. You can get cardiomegaly. You can get pulmonary and systemic congestion, ascites, peripheral edema, jaundice, pruritus, all can be effects of not treating your anemia. And then it's really important to refer her to appropriate resources like social services to help her get some help. There's this wonderful program called WIC, stands for Women, Infant, Children. They do some great education. They also do some dietary um, like vouchers for things like peanut butter and eggs and milk and cereal, like basic necessities to help boost the nutrition of women who have infants, and then I think it's kids to age like 4 or something like that. Um, Full transparency, we used WIC when I had my son. I was in nursing school when I had him. He's 17 now, but we used WIC and it was fabulous because we got some really great quality food, healthy and nutritious, and it helped us because I was in school, I couldn't work full time, and my husband had a terrible just out of college job, so it really helped us a lot and was very grateful for that program. So that would be an awesome thing to refer her to. And the programs exist for things like this, right? To help support folks who wouldn't otherwise have the resources that they need to be healthy. Okay, so let's talk about nutrient deficiencies and anemia, specifically pernicious anemia. So it's diet related, right? In a lot of cases. If you see the picture of all the things that have B12 there, it's a lot of proteins, right? So things that folks like some vegetarians, but mostly like vegans wouldn't eat, right? Fish, liver. um, so it can be a big problem for folks that don't have that regularly in their diet. Another problem is if you have some issues with your GI tract. So if you get some destruction of the lining of your stomach, the parietal cells in there, they get destroyed. And so you don't have this intrinsic factor. Intrinsic factor is what helps you digest this B12, okay? So it's really important that if you've got this type of anemia, you could give dietary and B12 all day, but if you don't have the cells to be able to produce the stuff to be able to digest it, it doesn't do any good. So in this case, you would do supplementation with either intranasal or IV because you can't give dietary because they just don't have the ability to absorb it. And then folks, again, with GI surgery, different cause, but same result, right? If you're removing parts of the stomach, then you're going to have problems with absorption. And then chronic alcoholism, they have the same problem with destruction of parietal cells, right? Because of the gastritis associated with chronic alcoholism. So with pernicious anemia, signs and symptoms of hypoxia, right? Because you have that oxygenation issue. And then they also get this sore, red, beefy tongue. You can have anorexia, nausea, vomiting, abdominal pain. And then something unique about this particular anemia is they get that paresthesia, so that numbness and tingling of the hands and feet. So that sore, red, beefy tongue and the paresthesia of the hands and feet is specific to this type of anemia. So make sure that you know that. Hint, hint. All right, and then when we start getting into folic acid deficiencies, it affects how your red blood cells mature. So when we showed you that picture where that one cell is kind of bigger than the other ones, that's the type of cells that you produce whenever you have a folic acid deficiency. So people at risk are, again, the people with absorption issues, poor diet, alcohol use, certain meds, pregnancy, and then if you get dialysis. Treatment, again, is supplementation, unless they have absorption issues. You would just have to be careful with that. Foods that contain folic acid are leafy greens, liver, meat, fish, legumes, whole grains, orange juice, peanuts, avocados. So we've got some non-meat sources there, which is helpful. Okay, so we're at an outpatient clinic. KL is a 78-year-old grandma. She has a hemoglobin of 8.7 and a hematocrit of 35. Based on the most common cause of these findings in the older adult, the nurse collects information about, what do we think? Probably not jaundice and dark tarry stools, right? Not everybody's jaundice. 3 days is not enough to cause a problem. Suppression of bone marrow is not really common. But in elderly folks, it would be D, right? So history of chronic diseases, cancer, renal disease, those sorts of things. Because older populations are more likely to have comorbid conditions, okay? Okay, blood loss anemia. So we've got acute versus chronic. So we talked about that in that slide before. So it depends on if it happens fast or slow as to how severe it is, right? So the goal is to replace the blood volume. So we are trying to avoid shock. And then we want to identify the source of the bleeding and stop it. If you have enough blood loss, we might give some packed red blood cells, that's what PRBC stands for, to help replace the lost cells, okay? And that's a picture of what a unit of blood looks like. So it's not the whole blood. They pull out the red blood cells and kind of break it into components, right? Um, and if you are losing blood, you're not just losing red blood cells, right? You're also losing plasma and clotting factors and things like that. So they might need other blood products in addition. With blood loss anemia, shock is the major complication, and that can be deadly, right? So we want to avoid them going into shock. Okay, we're going to skip case number 26. We're going to talk about that on Thursday. And this is my little joke. Okay, we will pick up with this in the second part of this lecture.